We'll be starting in a couple of minutes. If anyone has any questions, feel free to write in this chat. So for those of you who are waiting right now and just wanted to, and have been staying up to date with my videos so far, I just wanted to see what everyone thought about them so far, and if there's anything additional that they would uh, like to know about, just feel free to comment them in those videos. I try to make those videos relatively short for you all, and straightforward, with illustrations as guidance. It's just mainly a review, so hopefully it kind of helps when looking up mechanisms of action on certain medications, and seeing how even certain diseases, how they work also in the body. So a little bit pathophysiology there as well. So hopefully that kind of helps out a little bit in seeing things in a different perspective versus just reading the book and all to to understand the concepts. Now, this review. So my name is Snehal Desai, and I'm going to give you a short review on anxiety discussion. There really isn't too much to talk about here. It's probably only about 7 slides or so. So we'll just dive right in. Essentially what it is you'll see this in these illustrations and all, but what it is there's these three parts of the brain that kind of mainly plays a role in the balance of excitement and versus excitatory versus inhibitory pathways. So what you can see here in this table is anxiety. It kind of has its own little role in terms of a lot of nervous system this in comparison to other nervous system diseases. There are some differences, but it does have some overlapping parts as well with other disease states. So in this section, we're going to mainly focus on anxiety. So as I mentioned, like these three parts, the main thing you want to look at is really the amygdala, which is this fear center. Because when anxiety occurs, like if there's a threat stimulus, like a spider's, coming down a wall or coming down a ceiling, and then it kind of sends a stimulus to a brain that kind of creates that kind of alert. Then there's another stimulus that's going to be stimulated here, the stress receptor hormones. Then you have this excitatory neurotransmitter. So what happens here is this thing is going to really take place, and you're going to see less of the inhibitory or the control, and that is usually the prefrontal cortex, and also the memory part that's going to link the past experiences to the present, and that is going to also occur in the hippocampus region. Hippocampus. Think of it like campus, like kind of look at the books and stuff when I was studying for exams and stuff. Hippocampus. So that's mainly going to be your memory center, which is going to link right back to fear. Memory link past experiences to fear. Okay. So with that occurring, it's just going to lead to anxiety. So anxiety is really just mainly this response here. Too much fear signaling, not enough inhibitory control. So that's what's happening here. And then, as I mentioned here, the control center is the prefrontal cortex. So there's any way to really control it because of the too much excitatory neurotransmitter pathways going on. And then there's a lot of fear here, past experience linkage. And then these are the three main neurotransmitter imbalances that occur. There's more. This negative sign here represents that there is not enough GABA neurotransmission to inhibit or balance out the excitatory neurotransmitter. You can see more of the norepinephrine, and that's going to lead to more of the, you might see a slight increase in blood pressure. It could be a slight increase in the a little bit more of things that you don't want too much of, which obviously leads to a lot more of worrying and a lot more of, just give me 1 second here. So a lot more sweating and palpitations, hypervigilance, those kinds of things occur when there is more of this norepinephrine. Then you have serotonin neurotransmission that doesn't occur as much, just like the GABA. So these two, not much happening. But this one is definitely occurring. So this is happening. Okay. And so when we think about this, like sweating, because of that fear, that sweating, that palpitation, and you do get a little bit of the hypervigilance. And that's what's leading to anxiety. And so what's happening here, because of that, you're seeing one action potential, two action potential, three action potential, and then every single one of these action potentials are just occurring due to that state in fear. And so you'll see maybe one dendritic or one dendrite here. Let me draw it out here. You see a little bit of that. There's the cell body, the axon, the axon terminal, and then obviously you're going to see another part here where another, like the dendrite is taking that neurotransmission, and then you can see here, this is firing a one, but then another one gets fired. And it just keeps going on. And so these action potentials, basically what it's going to do is this thing's going to go in, and then this thing normally would probably see a lot more of this going out, but because of this action potential, it looks like there's going to be more of the sodium ions going in to depolarize. And then when the sodium ions go in, it's actually going to release these neurotransmitters, these excitatory neurotransmitters, glutamate. And what is that neurotransmitter? It's glutamate. And glutamate is going to bind to that receptor and open up the ion channel. And then it's going to further be used in that process. Now, whenever there is this occurring, before any neurotransmitter is released, it needs to go through exocytosis. Those particles that's in that one axon potential or axon terminal that's going toward the dendritic part of the other neuron, it needs to, let me kind of draw this out in a bigger form so you can see here. So like here's an example. So you could see here, this is a presynaptic neuron. This is a synapse. Here's a postsynaptic neuron right here. Postsynaptic neuron. Now, within it, there's a couple of things happening. Action potentials occurring. Sodium is going into the cell. Potassium is already in there, so it's going to depolarize. There's these little, I guess, circles, vesicles, you could say. Let me kind of draw in blue so you could see here. So these are like little vesicles here containing some particle neurotransmitters in here, and they can't be released unless calcium is available. So calcium is going to be needed to kind of exocytose this neurotransmitter out of the presynaptic neuron into the synapse. And so these things going to open up the ion channel here once it binds to that part and then release the ions. And so that's what's essentially happening here. So you could see that. And so you will definitely see a lot more of that happening when it comes to anxiety, a lot more firing, but very little control or inhibition, or GABA, which is the inhibitory neurotransmitter. So this is a better diagram here. You can see here the presynaptic cell right here, and in the postsynaptic, you can kind of see how this obviously is the dendrite, and then this part is the axon terminal. So you guys can see how they're kind of connected. Okay, and then you could see in a bigger form of how this part is shown here. So you could see how the glutamate is the excitatory part. When it is used, normally it would get converted to GABA. However, in this case, it's going to be really exciting the neuron, the other part neuron. So it's going to definitely decrease the inhibition. So it's going to increase the amount of excitatory, and this part is going to be decreasing. So this is actually a little bit more of a balanced receptor activity. You would see glutamate would convert to GABA. GABA would be used to kind of inhibit through release of chloride. And that's essentially what it will do here. These are the types of medication you would use to treat anxiety. And like benzos, barbiturates, phenbamate, zonisamide. And so that's essentially what is going on. Now, you can see how this can also be a disruption for someone having any other types of diseases as well. And so being cautious with certain types of medications like barbiturates and benzos is very important, especially since they can lead to more of a sedation, profound sedation. Also being aware when talking to your patients about respiratory depression. Those are some very typical type of side effects that may occur, especially when you're trying to inhibit these neurotransmitter pathways. A lot of times they can uh, cause more problems too. So be very cautious. Um, you know, understand the drug utilization review, and make a professional decision. So you can help your patients better understand these medications, and how to take them more safely. So some patients might have multiple disease states. They might have Parkinson's, anxiety, and Alzheimer's, or or as they might have schizophrenia, those kinds of diseases. So it's always good to have at least a understanding of all of these different types of nervous system diseases, especially since many patients who are experiencing pain or they're having anxiety, they may be taking one or two of these barbiturates or benzos and a pain medication together. So it's very important to understand that. Um, Also to understand, like, someone taking Percocet, Norco, or um, someone taking um, like anti-seizure medications. Um, Having at least an idea in the processes of how these medications work and making a decision is important. Um, Another medication I did want to mention was morphine as well, which is another one that could be used for pain. So when it comes to pain medications and taking medication for anxiety, that can be a contributing factor to many of these other types of side effects that patients could receive when they get these medications. So it's very important to help them understand, um, uh, you know, the purpose, um, or at least having an understanding of these purposes before um, the patient takes it. So that was pretty much it in this video. I just wanted to kind of share some information here with you all. There is still a lot more to discuss, which I will be presenting in my future videos, as well as some new um, medications that were recently approved by FDA, and having those kinds of discussions as well. Um, so please feel free to use any of the resources here. They will always be available to you all whenever you need help on understanding certain concepts or you need to take a look at some diagrams and all. These videos are there to help guide your understanding in how these medications should be used, um, and how they work. Um, so again, if you have any questions, please feel free to let me know or let us know. And that would be it. Thank you for watching, everyone. Hope you all have a good day.